a 37-year-old woman with a history of anorectal abscesses, complains of pain in the perianal region. Physical exam reveals mild swelling, tenderness, and erythema of the perianal skin. She is prescribed oral ampicillin and asked to return for follow-up 2 days later. The patient presents with high-grade fever, syncope, increased swelling. Which of the following would be the most common mechanism of resistance leading to failure of antibiotic therapy in this patient? So is it use of an altered metabolic pathway, a drug efflux pump, production of beta-lactamase enzyme, intrinsic absence of the target site, or altering structural target for the drug? Pretty simple question, production of the beta-lactamase enzyme. So this patient had an infection. He was given ampicillin, but the infection didn't resolve. So that obviously means that there is some amount of antibiotic resistance which is developed there, and you just have to be able to figure out why that's happening. So the patient has developed an abscess which is not responding to ampicillin. So that is enzyme inactivation by the production of beta-lactamase. So this is the mechanism of action to penicillin group of antibiotics. So that's the beta-lactam ring. The beta-lactamase, it will break the bond in the beta-lactam ring to disable the molecule. And a bacteria with this enzyme can resist the effects of penicillin and other beta-lactam antibiotics. So that bacteria, which was responsible for the abscess, is now producing this enzyme. So whenever we're giving ampicillin, the enzyme is just breaking down the ampicillin, and the ampicillin is not able to do its work. So the probable etiologic agent, in this case Staph aureus, other bacteria that can produce beta-lactamases are H. influenza, Neisseria. Enzyme inactivation can also be seen with the carbapenemase producing Klebsiella. So this is very important to remember, along with the mechanism of resistance of other antibiotics. This is a very high yield. Okay, so sulfonamides, they act by inhibition of PABA, which is used in the metabolism of bacteria. So sulfonamide-resistant bacteria, they do not require this PABA, which is an important precursor for the synthesis of folic acid. And instead, these bacteria use a preformed folic acid. Tetracycline resistance is due to the presence of an efflux pump that prevents the accumulation of drug in the bacteria. So the bacteria, whenever we give the antibiotic, it enters the bacteria, but then the bacteria just keeps pumping it out with the help of this efflux pump. Thus, this is not the mechanism behind the ineffectiveness of penicillins. Organisms that do not possess the target site for certain antibiotics are considered to be intrinsically resistant. So the absence of a cell wall in the mycoplasma makes it resistant to penicillin. So we all know that mycoplasma does not have a cell wall, and we know that the treatment of mycoplasma is with azithromycin. So the reason we use azithromycin for the treatment is because it doesn't have the peptidoglycan cell wall, which is the main site of action of the penicillins. Okay. And altering the target site is the mechanism of action of Streptococcus pneumoniae, Staph aureus, production of a mutant or a new penicillin binding protein. It alters the target site for the action of penicillin. However, the most common mechanism of resistance against penicillin is production of beta-lactamases. So all of these, especially the mechanism of resistance for tetracycline with the efflux pump and the penicillin binding proteins, these are very high yield mechanisms of resistance to remember.
Thanks for watching. Please give a thumbs up and subscribe for more.